Okay. Thank you, Dr. Neha Kakar. So today is the 1709th uninterrupted day of webinar from International Forum for Promoting Homeopathy. Good morning, good afternoon, and good evening to all of you from from the different parts of the world. So before we start today, we will have 1 minute silent prayer, please. Thank you all. Today we have a wonderful session from Dr. ARPANA Sandeep Pareek. I think she is already joined. Please make her a co-host. And today she will be speaking on the role of Dr. Yingling in homeopathic repertory. It is a interesting topic. Yingling is a new name for most of the homeopathy doctors. We are eagerly waiting to hear from Dr. Arpana Sandeep Parikh, who is having an MD in homeopathy and a PhD scholar. She is the professor and head of the Department of Repertory, Srimad K.V. Abad Homeopathic Medical College, Chandwad District, Nasik, Maharashtra in India. And she is PG Guide to Maharashtra University of Health Sciences, Nasik, and also PG Guide at Hanuman College of Homeopathy in London. She is a nodal officer for Central Council of Research in Homeopathy and faculty member of Health Sciences Education, Technology and Research Methodology, Maharashtra University of Health Sciences, Nasik. And also member of review board of Health University in Maharashtra, and the editor of the book Futuristic Trends in Medical Sciences under Iterative International, and the coordinator at College Criteria 8 NAC Health Science and Educational Technology Committee. And she had many awards, honored with the best contribution in the institution of her college where she is teaching on 2022, honored with the Young Achiever Award in Bangalore, honored with the Homeo Gaurav Samman in 2023, and honored with the Noble Indian Eminent Professor Award in 2024 in recognition of her consistent superior performance in homeopathic repertory. Woman Icon Award in 2024 from Women World Records. So awards of international origin in 2024, and secured second rank in state level research competition organized by the Maharashtra University of Health Sciences. And she had 21 papers published. And the topic today again is role of Dr. Yingling in homeopathic repertory. Over to you, Dr. Arpana. Are you there? Dr. Arpana? Dr. Danesh? Dr. Arpana is here?
Yes, doctor is there, but you may please make her co-host. You are the host.
Okay. Please hand raise, Dr. Arpana. Please raise your hand. Please open your video. Please open your video and raise your hand so that we can make you co-host. So I did. Okay, doctor. Yeah, I have seen it. Yeah, you are a co-host now. Go on, Dr. Arpana Sandeep Parikh. Over to you.
Okay. Thank you very much, sir, for a big introduction about me. First of all, thank you very much, Dr. Sahani, sir, for giving me an opportunity to deliver a lecture on Dr. Yingling's contribution in the field of repertory. So, without wasting too much time, because it is a big topic, and I will share my screen.
Please go.
Is it visible?
Yes.
Yes. Okay. So today my topic is role of Dr. Yingling in homeopathic repertory. There are lots of stalwarts who came in the field of homeopathic repertory and prepared their repertory. But the role of Dr. Yingling is very much important because he had prepared a repertory on pregnancy. No one has done this type of work as Dr. Yingling did. So, first, we should know who is Dr. Yingling. Who was Dr. Yingling? So, Dr. Yingling, the full name of Dr. Yingling is Dr. William Augustus Yingling, and he had a good contribution in the homeopathic repertory. That is called as the name of the repertory is the Accocher's Emergency Manual Homeopathy in Pregnancy. So he prepared a repertory which we can use at the time of pregnancy. Whatever complications occur during labor, during postpartum period, we can treat the cases of all these pregnancy related problems with the help of Accocher's manual. So we should know first about the author, that is, who was the author, what was his profession. So Dr. William A. Yingling was a prominent American homeopathic physician. He was known for his significant contribution to the field of lived. Whatever field he had selected, he had a good contribution in his field, and he practiced in Emporia, KS. A KS means a city in a Kansas, USA. Everybody knows from 1896 until his death. So he had practiced there. He was educated for medical missionary work, but after receiving his appointment go to Bombay, India, he came to India and he became ill and could not carry out that mission. He had planned to work for medical missionary, but because of his shifting from USA to Bombay, he became ill and could not carry out that mission. So he worked as a pulpit at Findlay and at Ohio for 7 years and then moved to Dodge City where he engaged in the cattle business. So apart from that practice, he also engaged in the cattle business and he named the Nest County town as Non-Chalanta in 1886. So all these are the contributions which Dr. Yingling did in his lifetime, and he reluctantly returned to practice medicine to address the healthcare needs of community. He, he knew that there is a need for communities of his practice. To relieve the sufferings in the area north of Dodge City, his practice became extensive, extending to the neighboring states. He was so much popular at that time and he was quite religious. This is a very important point. And missed Methodist Church service just once in 32 years. During his lifetime, he missed only one time the Methodist Church. He passed away at the age of 82 at his home in Emporia, Kansas. So this is all about the life sketch of Dr. Yingling. He had a very good contribution in the field of repertory. So the contributions of Dr. Yingling is that in 1895, Dr. Yingling authored the Accocher's Emergency Manual. And what is that? It is a comprehensive, so that we can easily understand. And it is a comprehensive guide focusing on homeopathic treatments during pregnancy, labor, and postpartum emergency. Whatever postpartum emergency we face, we can use this. I have used this repertory for not several cases, but in few of cases and got very good result. This work remains a valuable resource for homeopathic practitioner and midwives. And it is very useful for midwives because it plays a very important role. So first of all, we should know the meaning of accocher. The meaning of accocher is one that assists at a birth. So Dr. Yingling kept his book name as Accochers because Accochers it assist at a birth. So therefore he gave the name. So we will go in detail about the this repertory. The Accocher's Emergency Manual, that is Homeopathy in Pregnancy, is a specialized homeopathy guide focused on the treatment of pregnancy-related conditions and emergency. And the manual emphasizes the use of homeopathy as a safe and gentle approach to managing health during pregnancy, labor, and postpartum. So we have to remember several times that it is useful in pregnancy as well as labor as well as postpartum. So this is the book you can see here. So this is the book. On the book it is written that whatever I told you, the full name of the book is the Aperture Emergency Manual by Dr. W.A. Yingling, MD, and he was a PhD. And he was a member of the International Honeyman Association. So this is the first page of the book. And the key feature of the book is that I have already told you that it is helpful in the emergency arising during pregnancy, childbirth, and the postpartum period. And what are the common emergency during this period? That is, number one is the preterm labor. If hemorrhage occurs, breech presentation, postpartum complications are covered with recommended homeopathic remedies. So he provided all these remedies in his repertory, in the therapeutic part as well as the repertory part. So the books serve as a practical resource for both homeopathic practitioners and midwives, offering easy to reference section for quick decision making during emergency. So you can get remedies very quickly when you will refer this repertory. I will show you the repertory afterwards. So this is the main contribution of Dr. Yingling sir. It is heard that he had written also a repertory on the appendicitis, but no literature is available regarding the appendicitis. But the literature of this Aperture's manual is available, and this book is also available in the every PG department of every PG college, because it is kept in the syllabus of the PG repertory. This book includes dosage guidelines. Quick decision making during emergency you can do. This book includes dosage guideline, potency recommendation, and instruction on remedy administration during pregnancy and labor. So he had not only given the repertory part, but he had also given the instructions regarding the dosage, potency, and remedy administration. Now, regarding the book, I have told you that the popular is the Aperture's Emergency Manual. So we have seen that nowadays there are lots of modern homeopathic gurus and their doctrine. But because of this, we are missing some wonderful book. And this book is come under the category of that wonderful book by old master. So this was an old book which is written by our old master, that is Yingling, which are games and gives wonderful clinical tips which adds in practice. I have not seen any book which is written on the labor, postpartum complaints, and pregnancy. This is the wonderful book which you can use in your practice for all these complaints. And this is an attempt to introduce this wonderful book to young practitioners and homeopathic students. These were the words of Dr. Yingling. So this book is divided into two parts. First, the introduction part is given, and then this book is divided into two parts. The first part is the therapeutic indication, in which the different remedies are given with their indications in all these complaints of females. And the second part is the repertory part. So, under the preface, which was written by Dr. Yingling, so whatever words he had used, I am telling you all those words. So the words of Dr. Yingling is that necessity is not only the mother of invention, but the impelling force in the preparation of such monographs as this little book. Sir is telling that I have prepared this like a monograph, and it is a little book according to him. So who with a heart does not pity the suffering parturient woman? Sir is very sympathetic for all these women. Sir is very sympathy for all these women who were suffering from parturient complaints at that time. So therefore, Sir has written this book to relieve the sufferings of all those women who would not labor to relieve her sufferings when he felt that he could. So Sir is telling that with a heart does not pity the suffering parturient woman who would not better labor to relieve her suffering when he felt that he could. This has been the force behind the pain of the heart. This leads Yingling sir to write this book, this repertory. There need be no excuse for sympathy. There is no need for an excuse to show compassion. These are the words of Dr. Yingling in his preface. So with the help of the manuscript of this book, relief from suffering has been achieved in cases that would otherwise have necessarily required instrumental delivery. Nowadays, most of the obstetrician or gynecologists use instrumental delivery with the help of forceps or cesarean section, and natural labor has been expedited. to make something happen more quickly. Huh? So what generally they do? They use the instrument and do the delivery. So Dr. Yingling has so much sympathy for all the women who are going through all this instrumental delivery. So knowing from experience that the indicated remedy is the best friend of the laboring woman. These were the sentences of Dr. Yingling. It restores the organ to their normal condition and according to the circumstances and anatomical structure, this provides, homeopathic remedy provide an almost painless delivery. These are the experiences which Dr. Yingling had experienced. My compassion for those who bring human life and immortal souls into the world has inspired me to offer this assistance to the profession. So these sentences Doctor used in his preface. It is expected that this manual will lead the obstetrician directly to the indicated remedy without any hesitation or delay. So obstetrician can see directly a homeopathic remedy by using this repertory. And many people have experienced that they face uncertainty at the bedside. Sometimes at the bedside they become uncertain and which forces them either to guess or to return to the office to review the case. In this, their time will be wasting their valuable time or to resort to routine methods and interventional midwifery. So, to avoid this, Dr. Yingling sir has given this concept of using the repertory for bedside. And this manual remedy this difficulty and give the prescriber the power to relieve sufferings and bring glory to the great cause of homeopathy. This is the sentence, very important sentence, glory to the great cause of homeopathy. If the prescriber will depend on his remedies, carefully selecting them at the bedside, he will gain confidence in them and in himself, for he knows where do the remedies and more promptly and efficiently like magic, transferring real pain into the expulsive force of labor without undue suffering. When we prescribe this remedy from this repertory, their pain will be magically transferred into the expulsive force of labor without undue suffering. So this Dr. Yingling had experienced after prescribing these remedies. Although all irregularities of labor can be managed through treatment alone, it will. So the concept Dr. Yingling has cleared that these remedies will not enlarge the bony structure. This remedy will it remove congenital or lifetime induced deformity, nor will it immediately eliminate the effects of local morbid growth, cancer, etc. But what these remedies will do, the cases without the sphere of action of the homeopathic remedy are comparatively few. We have a universal law, and in no class of cases will the prescriber get better or quicker result than in those of liver. Sir has experienced this. So sir confidently said that with the help of all these remedies which he had given in the repertory part and the therapeutic part, the labor woman get quicker result. These are the reasons for this manual. These are the reasons for that doctor has written this report. Overlook the imperfection. Sir is telling that don't overlook the imperfection of detail and plan and seek the good for the relief of your trusting and expectant patient. Only see the good things. Don't go for the imperfection, whatever Dr. Sir had done. So in the introduction part, the first part is the introduction. So this part contains 12 pages. And the main object of the book is to give assistance in the emergency and at the bedside. The book contains remedies and their application to the abnormal conditions of parturition, those which occur directly before, during, or after labor or abortion. So here the symptoms alone must point to the curative remedy. So this is very useful book in obstetrical practice. Give the remedy, the pathogenesis of which entirely covers the symptoms of the patient. So how we will select the remedy from this repertory? Give the remedy when the pathogenesis of a remedy entirely covers the symptoms of the patient. Only at that time you prescribe the remedy. Afterwards, I will show you some cases in which you will see that how the remedy has been prescribed with the help of this repertory. The author has simple plan where the first part contains the therapeutic indication. I have told you the first part contains the therapeutic indication under various rubrics. The author says abnormal labor may be made as natural as the condition and circumstances permits. So abnormal labor may become natural. By this book, one can observe the rapid action of the simillimum in obstetrical practice. The author has asked to follow the directions which were given by Dr. Samuel Hahnemann as given in the organelle and the chronic disease while prescribing to get an effective result. The author has also emphasized that with the help of remedy, there is no use of forceps, which I have told you. When you will use this homeopathic remedy, so there is no use of forceps and other obstetrical instrument, whatever obstetrical instruments nowadays the obstetricians are using. But when we use this homeopathic remedy, there is no need of obstetrical instrument, but should consider them when there is a real necessity. So we can use. It is not completely said that you don't use. When there is real necessity, you can use the obstetrical instrument. Regarding chloroform, sir has told that with reference to the chloroform, the author has mentioned that it is used in extreme cases where the simillimum cannot be found or where instruments are necessary, as the chloroform lessens the power to cause voluntary muscular. So these are the concepts regarding chloroform the author has mentioned. Many of the cases it has been used in extreme cases whenever the simillimum cannot be found or where instruments are necessary. So regarding chloroform, sir has given this concept. Author also informs that by properly selecting simillimum, the postpartum hemorrhage can be controlled and life can be saved. And this same can be applied to the purpural eclampsia. Everybody knows what is purpural eclampsia. If you will see the repertory, you can get the remedies regarding the purpural eclampsia. Author has also mentioned about potency. I have told you. He had also told about the potency. Higher potency act much more promptly. Sir has emphasized on the higher potency for treating this type of condition and efficiently and are best in labor cases and are quickest in action, especially in emergency cases. If the remedy is simillimum, then there is no need for repetition as its action is speedy regarding the repetition. If there is no change, then the selected remedy is wrong and another remedy must be selected. This is a good concept. In ordinary complaints of labor, half hour can be waited, but in emergency, within few moments, result is expected. If no result follows, a new remedy must be selected. Definitely. If there is change for better, then wait until there is need for repetition. So these are the ideas, these are the instructions given by Dr. Yingling. So I'm telling you now about the first part. The first part that is called as a therapeutic part. You can see the first part, the first remedy is the aceticum acidum. So the therapeutic of all the drugs are given in this part. You can see here the drugs index and the another index that part 1 remedies are given starting from the acetic acid and ending at the zincum mate. So total number of remedies are 108. So there are 108 remedies from acetic acid to zincum mate, and all the remedies are arranged according to the alphabetical order. As we see in every repertory, the remedies are written in index part alphabetical. So each remedy has subheading that is called as rubrics. You know everyone the rubric. So therapeutic indication in every remedy there are some headings starting from the labor. Is the detailed information about that particular remedy regarding the labor is given. After that, symptoms of abortion, hemorrhage, what type of hemorrhage is there in the acetic acid, what type of hemorrhage in the zincum, retained placenta, convulsions, after pain, the baby. The most important part of this therapeutic indication, that one therapeutic indication part is the baby, and the last chapter is the generality. So in this way, every remedy has these 8 headings. So regarding this, author says that rubrics are distinct in their general feature, yet the peculiarities of the remedies are also covered. Suppose you are taking rubrics from a labor patient and you are very confused. You are getting 4 or 5 remedies after repertorization. But for confirmation of that particular remedy, you can go into the therapeutic part and you can select that particular remedy. The repetition of symptoms under the various rubric is intended to impress the prescriber those red line peculiarities of the remedy. So first remedy selection, finally you have to go into the therapeutic part. In generalities, the last section of every remedy, that is the generalities, he gives a bird eye view of each remedy. so as to enable the prescriber to get a totality of the drug. In the last part, he had given a bird eye. Definite pictures are presented of each remedy, which will aid in selecting the true simile. So definite pictures are given of each remedy. The part two which Dr. Yingling has described in the part 2 is the repertory part. This is the part 2 that is contains the repertory. So it starts with the labor. So you can get the rubrics. You can see here the first rubric is the abdomen. Tearing down, grade seems to be only in the walls of agaricus. Plotted with calicar, cramps in with shooting down the legs, viburnum ocular, cramps in gelsemium. So you can get all the rubrics, you can get the remedies, and for confirmation of remedy, you can go into the therapeutic part. So repertory part, it contains 7 chapters. Authors call them as repertory, and their rubrics and sub-rubric, the chapters are labor. In every repertory, you can see there are chapters. In Kent repertory, there are 37 chapters or 33 chapters. But here also, Dr. Yingling has given the name to the chapters. The first chapter, which is very important, that is the labor. Second chapter, abortion. Third chapter, hemorrhage. What type of hemorrhage the patient is experiencing? Retained placenta, convulsions, after pains, and the baby. These are the 7 chapters which he had provided in his repertory. Of all the chapters, the hemorrhage chapter is the largest one as it contains 17 pages. The important chapter, the largest chapter is the hemorrhage, followed by labor and abortion, which are 16 pages each. So there are only 7 chapters, and the largest chapter is the hemorrhage, and the followed by labor and then abortion. Hemorrhage has 17 pages, labor and abortion is 16 pages. And the last chapter, that is baby. The baby is the smallest chapter. The rubrics and sub-rubrics are all arranged according to alphabetical order as in other repertories. And if you will study, careful study of them will facilitate greatly the search for a remedy in emergency. If you will study carefully all the rubrics, and those rubrics definitely facilitate you for selection of remedies in emergency. So author's main intention was to inspire confidence in those who are wavering in their faith and practice, especially during emergency. And this book gives lot of confidence in handling the obstetric cases both during and after. So in modern days, as there are so many super specialties in homeopathy are coming up, you can see it. So it is a book of necessity, especially who want to concentrate on obstetric and neonatology, especially for the female homeopaths who want to concentrate on obstetric and neonatology. Till today, which I have seen, this is the most neglected in homeopathy. So it is my request for everyone to use this repertory, especially female homeopaths, in their practice to treat the obstetric and neonatology cases. So you can see here, this is the baby chapter. Abdomen, hard places in the skin of and thighs quickly increasing, camphora. Deep redness spreading over the whole camphora. So this is the chapter which I am showing you regarding the baby, the last chapter of the repertory. You can see there is a calendar, obstetrical calendar for calculating the period of uterogestation. So for expected date of delivery, you can consider this chapter. A method is given. In the last explanation is given. You can take a peek of it, how to calculate the expected date of delivery. Now index. The index in the last part, the index is given. So regarding the part 2, I have told you abortion, after pains, convulsion, hemorrhage. So these are given alphabetically. So lastly, the obstetrical calendar is given. Before that, the baby, and all the chapters of repertory part is given here in the form of an index. The last part of the repertory, suggestion to patients given by Dr. Yingling. These 16 pages were stitched little leaflets. And also by the same author, Boyningason, repertorial checking list is also given. So this is the last page of the book. Now, this is all about the book which was written by in the form of repertory by Dr. Yingling. So, by using this repertory in my practice, I have solved some cases and got very good results. So, one by one, I am showing you the cases which were treated by using this repertory. So, case 1. In case 1, a patient came with labor pains. Those were weak and very irregular. Cervix slow to dilate. Cervix was not dilating. Patient exhausted and trembling. Anxiety and fear of labor outcome. The patient has severe anxiety and patient has a severe fear of labor outcome. Okay, what will happen? Continuously, when I have seen the face of that lady, the face was so much anxious and she was so much fearful. Mouth of the patient was dry and the thirstless. Patient was thirstless, and when the examination was, uterus feels as if losing power. When the examination was done, it was felt that the uterus was losing power. So repertorization was done in a very simple way. So drugs which came after repertorization, the first drug is colophylum. So the symptoms of colophylum I have seen in the therapeutic part: weak, inefficient pains, cervix slow to dilate, and trembling exhaustion. All symptoms just we have seen. So I have confused with the gelsemium also, because in gelsemium also there was a trembling with anxiety. In gelsemium also there is anxiety, lack of strength in uterus, thirstless. So pulsatilla, I have also thought of pulsatilla. Pulsatilla, this remedy I also thought of. That is irregular pains, emotional, tearful, better with fresh air. Fecal core was also in my mind. Uterus lacks contractile power. Uterus is very less power. Exhaustion. Patient was very much exhausted. Prefers full application. I have read all the 4 remedies and finally I choose the remedy colophylum. 30C, not 200. I have given only, although Dr. Yingling sir told that given high potency, but I selected 30C according to my concern. So I have given colophylum 30C every 30 minutes, and the outcome was that pains become more regular, cervix dilated, and labor progressed very smooth. So this was the first case. This was the first case, the case of prolonged and exhausting labor. The second case, which electricity has gone. I'm continuing with my topic. So, case second was threatened miscarriages in early. Actually, here raining is going on, so there is an electricity problem. So the second case, actually, PPT is not shared. I think PPT is. Are you seeing my PPT?
No more.
Yeah. 1 minute, sir. 1 minute. Sorry.
Yeah.
Okay.
Please unmute, doctor. Yeah.
Okay. Sir, is it visible? My screen is visible?
No.
Okay, sir. 1 minute. Actually, because of electricity problem, I'm sharing again.
Yeah,
Now?
it is coming.
Okay. Sorry for the disturbances. Second case, the patient is complaining of cramping pain in the lower abdomen, red spotting, worse with movement, weakness, and a sinking in the stomach. So this is a case of threatened miscarriage in early pregnancy. Sir, is it visible?
Yeah, visible.
My screen is okay.
Yeah, your screen is visible, doctor. You can continue.
Okay, sorry. So profuse bright red blood. This was only few complaints of the patient and remedy which I have prescribed. Repertorization was done using Yingling's repertory. The remedies came where the first remedy which I have prescribed, I have kept on the top. The first remedy is the Viburnum opulus, cramping pain in lower abdomen with threatened abortion. Second remedy, that is Sabina. So for Sabina, dark red bleeding, worse with movement, history of repeated miscarriages. And the symptoms of sepia, which I have seen, is bearing down sensation, as if everything would fall out, Patient is irritable, so I thought of sepia, indifferent to loved ones. Another remedy is simicifuga, that is Actia racemosa. Sharp pain from hip to hip, fearful, emotional, and history of miscarriage. So among all these remedies, I have selected the Viburnum opulus, 30C. Again 30 I have selected 3 times a day, and the outcome is bleeding reduced, cramps subsided, and the pregnancy continued safely. Another case, the third case, which I want to show you, that postpartum hemorrhage, that is called as a PPH after delivery. Patient came with the complaint of profuse bright red bleeding after delivery, weakness, dizziness, and cold sensation. Uterus fails to contract properly. Patient was anxious, restless, and worse from situs mode. These are the complaints of the patient. When repertorization was done, 4 remedies came in the mind. Sabina has profuse bright red bleeding, was from motion. Cecal core was also thought of because of persistent using of dark blood, exhaustion, prefers cool air. Therefore, cecal core was thought of. China, weakness and dizziness from blood loss and ringing in the ear. So this symptom was not present in the patient. Phosphorus was also thought of because hemorrhage was there. Hemorrhage with bright red blood is also there in Sabina as well as the phosphorus. And thirst for cold drinks and prefers cool air, that was in cecal core. But thirst for cold drinks was in phosphorus. For by considering all these 4 remedies, the remedy which was prescribed in 200 potency was Sabina. It was seen in the therapeutic part as well as in the repertory part. From the repertory part, these 4 remedies I got, but when I considered all the symptoms properly and I selected Sabina from the therapeutic part, it was repeated every 15 minutes because the case of a postpartum hemorrhage until bleeding reduced. And outcome was that bleeding slowed, uterus contracted, and patient is stabilized. So this is a case of postpartum hemorrhage treated with the homeopathic remedy by using the Yingling's repertory, especially prepared for the cases of labor, pregnancy, and emergency. The fourth case of a rigid cervix. Patient came with the complaint of rigid cervix and preventing labor. Because of this rigid cervix, labor progression was prevented. So strong contractions were there, but cervix remains rigid and undilated. Patient was experiencing intense pain with every contraction, but the cervix was rigid. See here, what remedy I have given. Patient is highly irritable and sensitive to pain. Actually, at the time of labor, every patient becomes irritable and sensitive to pain. So this symptom is a common of every labor patient. Face was flushed, eyes red, and pupils dilated. Similarly, restlessness was also there. Patient was very anxious. So I am not writing the whole case in detail here. So that will take lots of time. So with the help of this symptom, I have considered the repertory part. And after consider the repertory part, the remedies came belladonna, gelsemium, chamomilla, and coleophyllum. So how I compare this in belladonna? Pains were violent, spasmodic pain, cervix remains rigid. This is given particularly in belladonna that cervix remains rigid, flushed face, dilated pupil. All these symptoms just I got in that patient. Gelsemium, in also gelsemium there is rigid os with trembling and weakness, fear of labor. There is excessive fear of labor in gelsemium. Chamomilla, chamomilla is extremely sensitive to pain, irritable and restless. Once I thought of giving chamomilla, but I have prescribed the belladonna. Coleophyllum, in coleophyllum also there is a cervix is rigid, ineffective contractions and exhausted but restless. So by considering all these 4 remedies and after uh, consulting therapeutic part of this Yingling repertory, belladonna 200C every 30 minutes was given. After that, I have seen that after every 30 minutes, after 2 hours, it has been seen that cervix softened, cervix become softened, contractions become effective, and labor progress normally. So belladonna plays an effective role in treating the when cervix is rigid. Case number 5, a very good case. This was a very good case. The patient is experiencing false labor pains. Symptoms were pains mimicked labor without any cervical change. The patient was nervous and sleepless. Remedy was given simisifuga in 30 potency, and outcome was false labor subsided and true labor began normally 3 days later. Not immediately, but 3 days later, true labor began. And the remark is that simisifuga helped calm the nervous system and normalize uterine tone. So remember this simisifuga remedy for false labor pain. By considering Yingling's repertory, I have prescribed the simisifuga in 30 potency. Case number 6. Now our small cases, I am showing you all the small cases. Retention, placenta not expelled. So many times this has been happened that placenta is not expelling. So for that I have used remedy for the expulsion of the placenta. So presentation was that after a normal.
So there is an electric failure and maybe network problem. Doctor disappeared.
I am audible, sir, now.
Yeah,
Here is
you're audible.
going on and problem. Okay. So the pulsatilla remedy 30C was given. Outcome was that placenta was expelled naturally within 30 minutes of the first. A very good result of pulsatilla without the need for manual extraction. So this is the case of placenta not expelled properly. Another case, delayed labor from emotional shock. Patient got emotional shock. Symptoms were labor halted after receiving bad news. So by considering the mental condition of patient, Ignitia 200 was given, and within an hour contraction resumed and labor progressed smoothly. So very good result. Only on the basis of mind condition this remedy was given. And remark is that Ignitia was chosen for its action on emotional suppression and sudden grief related labor state. So Ignitia plays a very important role in this type of cases. The next case of a breech presentation, a very good case. Have you seen that pulsatilla plays a very important role in all these types of cases? So I have used several times the pulsatilla. So the case of a breech presentation, for breech position detected late in labor, the patient extremely anxious and restless, and on the basis of this, I thought give pulsatilla. And when the pulsatilla 30 was given, fetal movement was noted, and within hours the fetus rotated to a position. A great case. The position of the fetus. So pulsatilla is known to aid in repositioning the fetus. What I have learned from this case, whenever we prescribe pulsatilla, the pulsatilla repose the position of the fetus and is well mild, yielding tearful patient. Actually, the patient was very tearful. Patient was very much. I have taken the history from the attendant because the lady was not in a position to give the symptom. And the next case is the labor pain to intense following. The patient with the cramp-like pains in the back and thighs and the cervix partially dilated. The cervix was not completely dilated. So in this case, I have given chamomilla. Pain became manageable and delivery occurred within 3 hours. A very good role of chamomilla in these types of cases. The cramp-like pain was there. Therefore, chamomilla was selected, and I have learned that chamomilla is indicated when pain seems unbearable, especially with oversensitivity and irritability. So every symptoms are not written here, but whatever things I have noted, I have mentioned all those symptoms, and on the basis of that, I have selected that particular remedy. Next case is premature labor. So premature labor from symptoms were uterine contraction and spotting begin after heavy lifting in the 7th month. The case of a pregnancy during 7th month, contractions started and spotting started. This is a case of premature labor. Remedy given Arnica 30. It worked very well by considering or by referring the Yingling's repertory. In Yingling repertory, Arnica was written for premature labor. Outcome that uterine activity ceased and the pregnancy continued to full term. The contraction have been started, spotting have been started, but when Arnica was prescribed, the uterine activity ceased and the pregnancy continued to full term. Remark was that Arnica was selected for trauma-induced uterine irritation. When the history was taken, it was
Dr. Arpana, how many more cases you have?
only one.
Only one. Okay, we
Only
need to
one, sir.
give,
Oh,
okay,
okay.
okay, complete it, and we need to give a short period for discussion, please.
So, case in this I have shown you that Arnica 30C was given because of that uterine activity ceased and the pregnancy continued to full term. Arnica was selected for trauma-induced. I have told you. Now, last case was that mental agitation before delivery. The patient was very restless, has a fear of dying during labor and excessive talking. So, on the basis of the aconite nepalus, because of fear of death actually the patient has fear of death, and during labor she will die. These symptoms continuously coming in mind of the patient that I will die during the labor. So remedy on the basis of the I have selected aconite nepalus 200, and the outcome is that patient calmed down quickly and had a peaceful, uncomplicated labor. So aconite was used for acute fear and anxiety before childbirth. So you can see whenever this type of patient comes to a practice like fear of death during labor, if you prescribe this aconite remedy, you will definitely get the result because of this. So these are cases which I have shown you. So this is my small effort to tell you about the this Yingling's poetry.
Okay. Thank you, Dr. Arpana. That is a very excellent presentation. There are treasures of so many things available about homeopathy in different parts of the world, in different countries. And it is very interesting and useful for homeopathy doctors to identify these things and bring to the awareness of the homeopathic doctors around the world. And Dr. Arpana has given a very good example and very good example of the same of bringing something big treasure useful for every homeopath around the world. Now we have open to discussion. So anybody who is interested to ask some questions about this repertory or anything can come out or raise their hand for asking questions. I invite Dr. Beatrice Jessner from Germany to communicate with Dr. Arpana. Dr. Beatrice.
Yeah, thank you. Thank you, Dr. Shadi Gudiat. Dr. Apara, I don't have a question, but I really can say I was very impressed by your presentation. First, you were explaining very well the life history of Dr. Yingling, which was interesting. She seems to be a practical person, and also showing very nicely the repertory, the different chapters, and impressing the cases, because we can do so much. The woman did benefit so much from the prescription, and this made really a difference, having a nice birth and not having such a big stress and perhaps an artificial intervention. So thank you very much, and congratulations for your very interesting cases too. If we have space for a question, perhaps I would be interested what's in the baby chapter. Is it, what are the topics over there? Thank you.
Thank you, Dr. Beatrice. Now, anybody else wish to ask questions or say something about the presentation? Please raise your hand so that we can invite you for the same. We have few more minutes remaining, 4 more minutes remaining. Anybody has any questions, please come forward. Dr. Arpana, are you there? Dr. Arpana, are you there? She had electricity problems, big rain in that place, so she is there. She is there. Dr. Arpana, you please unmute.
Hello. Hello.
Yeah.
Sir,
Yeah.
I have joined from
Yes.
mobile. Okay, sir. Okay.
Okay. So you wish to say any concluding remarks before we wind up? Dr. Arpana, please.
Yes, sir. So, it is my humble request to all the homeopaths to take the use of all these repertories which are even written by our stalwarts. This is very unknown repertory. Nobody knows about this. So whenever you will use this repertory in your practice, definitely you will get results. So this is a unique feature of repertory subject. Nobody has written this repertory on this subject of labor or pregnancy or emergency occurring during postpartum period. So it is my concluding remark that take use of all the repertories, and one by one daily you can use the repertories which you do not know. The repertories which you do not know, purchase them, read them, and you will get definitely benefited from all those repertories. Some of the repertories, this comes under the type of clinical repertory. So all these clinical repertory we generally use in our practice. There are lots of clinical repertory. You can use the Clark's repertory. You can use actually generally we use the Boric repertory. But these are the peculiar repertories which we have to use, such as Clark's repertory. The prescriber. The prescriber comes also under the category of clinical repertory written by Dr. J.H. Clark. So that repertory is also very important. You can use in your clinical practice. So this is my concluding remark. Ki don't follow all the general repertories, but these repertories are also very important. So you can also follow this repertory. Okay.
Thank you, Dr. Arpana. So this is very important, and as the future goes on, homeopathy is getting more popular and get into every specialty as a complete system of medicine. So these repertories become very useful for homeopathy doctors. So we wind up today. So we have one more minute remaining. So I invite Dr. Ram Pravesh Shah to say the concluding vote of thanks to Dr. Arpana. Please make it within 1 minute, doctor. Please. Unmute, doctor. Unmute. Yeah, please.
Thank you, Dr. Sadi Kudier sir, and congratulations, Dr. Arpana madam. Very nice presentation and role of Yingling homeopathic repertory. Very good described repertory. Very, very thanks, Dr. Arpana madam. Thank you, behalf of IFPH whole team. Thank you. Thank you very, very thanks again.
Thank you, Doctor. Thank you, Dr. Ram. It is time to hand over the session for the local Malayalam section. So over to Dr. P. Shaila for Malayalam session moderator. Good night to all of you from Philippines. Thank you. Good night.
Thank you, Dr. Shaji Kuriyat. Thank you, doctors in English session, Dr. Abarna, Dr. Beatrix, Dr. Yambarvish Shah, and all doctors in English session. Namaskaram. In the IFPH in the തുടർന്ന് വരുന്ന മലയാളം വെബ് പരമ്പരയുടെ 1708 ദിവസം ഇന്നത്തെ മലയാളം സെഷനിൽ നമുക്കൊരു ക്ലാസ് ആണ്. ക്ലാസ് എടുക്കുവാനായി എത്തുന്നത് ഡോക്ടർ രശ്മി MD ആണ്. ഡോക്ടർ തിരുവനന്തപുരം ജില്ലയിൽ എന്നോടൊപ്പം വർക്ക് ചെയ്തിട്ടുണ്ട്. വക്കം ഗവൺമെന്റ് ഹോമിയോ ഡിസ്പെൻസറിയിൽ മെഡിക്കൽ ഓഫീസറായി